Look, when it comes to carpal tunnel, I always tell my patients the same thing. That typing does not cause carpal tunnel. What causes carpal tunnel is the abnormal posture that you develop when you type. Yeah, but if you keep your wrist straight, okay, and let your fingers do the typing, keep your wrist straight and let your fingers do the typing, nothing is going to happen. What usually happens is the abnormal posture that the people develop when they type. They start kind of bending the wrist in all kinds of ways, and you just can't do that. Now what happens is the median nerve at the level of the wrist is very superficial. It's like having a little hose there, and if you have a hose, you can't bend it. And then often that's exactly what happens. So it's important that we understand this. We understand our anatomy. We also use preventive measures when it comes to the carpal tunnel. But listen, I've been typing neurological reports ever since 1995, and I typed thousands. But I always understood that you kind of relax yourself and let your fingers do the typing and don't develop that abnormal posture. I've met patients that have caught carpal tunnel by driving. Why? Because they have the tendency of bending their wrist. Instead of keeping the wrist straight, when you drive, then they bend the wrist. So you just need to kind of just be careful with that. So even if you're relaxing, just watching TV, don't do this. Don't bend the wrist. I know at one time, even myself, I was putting my hand under the pillow and I was just kind of bending the wrist, and I was waking up with my hands numb. And I just realized really quick that I was doing something wrong. So even when you drive too, like I said before, don't bend the wrist. And obviously, there's a lot of repetitive motions. We have to be really careful that we don't put too much stress in the wrist, and that way we don't catch carpal tunnel. But I think I've said it before, a good test for carpal tunnel for CTS is a nerve examination. We use electrical impulses to stimulate the nerve, and we can tell by the way the shape of the nerve looks and the latency of the nerve, which is the speed of the nerve. We also look at the amplitude, which is the height of the nerve, and the velocity, how nerve communicates from point to point. And one thing that I also give some of my patients, they love soccer, a little ball they can just do exercises in. They can just squeeze, they can just relax a little bit. I mean, it's a lot of exercises you can do, but this is key. One of these balls helps out a lot, and you can just be relaxing. You can just be squeezing it. And one of the things you want to do is the median nerve feeds this muscle here called the APB muscle. You want to strengthen this muscle, and if you do that, you're going to be okay.